Hi, my name is Scott. I'm a physical therapist and assistant here at North Point Orthopedics, and today I'm going to be talking to you about some low back pain. So a couple disclaimers before I show you some exercises for low back pain. I want to make it clear that if you are getting any radicular pain down either legs, if you are getting groin pain, or if you have bowel or bladder incontinence, we need you to come see your doctor immediately and don't even try these exercises. All right, so we are with Allison. She is one of our techs here. She's going to be showing us some exercises. So the first exercise I'm going to instruct her to do is called lower trunk rotations. So she's laying flat on her back. She has her feet flat on the ground and her knees are bent. What I'm going to ask her to do is slowly bring both legs to one side. Hold it for about 5 seconds, and then she go back to the other side as far as she can without pain. If she is getting pain, then she's not going to rotate that far. And back. She could do this 10 times each direction with a 5-second hold. So the next exercise we're going to have Allison do is called lower trunk rotation with a pectoral stretch. Our pecs kind of come up from our sternum and they attach on our shoulders right up here. And what happens is when we have that bad posture around computers, our chin kind of comes forward and our shoulders also roll forward with it as well. So what this is going to do, it's going to help open up that chest and allow for better posture. So all she's going to have is her arms out in a T formation, just like this, with her knees bent, feet flat on the bed or table, whatever you have available. And I'm going to ask her to go side to side with both of her knees together. So go on and come to this right side. She's going to keep her shoulders down, and she's going to hold this for 5 seconds. She should feel a very nice stretch up in here in the pectorals. Then she'll go to the other side. And when she brings her knees to that side, she should feel a nice stretch right here. Now, if she wasn't feeling a good stretch, what she could do is move her hands up a little bit higher, and that'll just give her a better stretch. So she's going to be doing this 10 times each side, 5-second holds each. Okay, so the next exercise we're going to teach Allison to do is called a bridge. It's actually a pretty easy exercise. All she's going to be doing, she's going to be in this position, knees bent, feet flat on the table. And I'm going to ask her to squeeze her glutes and lift her butt off of this table. So go ahead and lift. Good. Nice and slow. Come back down. She could do this 10 times. When it gets a little too easy, she could do 2 sets of 10. And what this is doing, it's helping us activate our glutes. When we are having low back pain, we tend to hunch forward a little bit, and that could actually contribute to decreased glute activation. And this is going to help reactivate them. So the next exercise we're going to be doing is called a hamstring stretch. We have a strap here. She could use a belt or a dog leash or a bed sheet even at home. So I'm going to ask her to do is she's going to lift this leg straight up, keeping her leg nice and relaxed while she's using the strap to pull. And she's going to get a nice gentle stretch right in the back of her hamstrings, right behind her knee. She's going to be doing this 10-second holds 10 times. And the reason why we want to do this stretch is because these hamstrings connect here, but they also attach at our ischial tuberosity. That is when you sit on someone's lap and they say you have a bony butt. That is exactly where they attach. And if they're too tight, that's going to be pulling on the pelvis a certain way, and it will cause stress on your lower back. So if we loosen these up, get them at the appropriate length that they're supposed to be, it should alleviate some back pain as well. So the next exercise we're going to have Allison do is called the piriformis stretch. So what she's going to be doing, if she could get there, is crossing this leg over this one so that her ankle is on her heel. And what she's going to be doing is taking her hands right along this knee, and she's going to be very gently pulling it to her chest. Go ahead and pull. So she's pulling towards the opposite shoulder, and she should get a very nice gentle stretch kind of right in the back of her hip, right along here, possibly even going up into her glute a little bit. She's going to be holding this 10-second holds 10 times. And remember, stretching should be gentle. You never want to force a stretch. Now, a modified version is if she cannot reach this ankle over the knee over here, what she could do is straighten out this leg. She could gently pull with both hands over here and just kind of give it a little extra pull over towards that opposite shoulder. With the leg being up and bent, it allows external rotation of her leg, which gives her a little bit better of a stretch. Again, 10-second holds 10 times. All right, so the next exercise we're going to be teaching Allison to do is called a posterior pelvic tilt. What this allows, it allows a little bit of contraction of your core, also known as your transverse abdominis, and that's located just around your pubic. So what she's going to be doing is she's going to be flattening her lower back into the table. This is a difficult exercise for some people to understand, and there are a couple cues. So the best one is to try and flatten your lower back into the table and bring that belly button in towards the table ever so gently. She's going to be holding this 5-second holds 10 times, and notice how her belly kind of sinks in and her pelvis rolls a little bit backwards. Again, this is not an easy exercise to understand if you have difficulty contracting your transverse abdominis, but she is doing a great job. So the next exercise we're going to be having Allison do is called hip adduction squeezes. What this does is it allows us to contract our core. So we have a ball here. There's a Pilates ball. You could get one like this from Amazon. You could actually buy a nice, kids bouncy ball at, a dollar store or something. What I'm going to have her do is she's going to put this right in between her knees, and she's going to squeeze this ball for 5-second holds. And looks good. She could do this 15 to 20 times. And if it's hurting her, you're going to feel it in your groin. If it's hurting a little too much, just squeeze a little less. Looks good. So the next exercise we're going to teach Allison to do is called a dead bug. It's a modified version so that this is appropriate for all different ages. So we have another Pilates ball here that's a little bigger. If you don't have one of these, you could also use a couple pillows for, thickness. What she's going to be doing, she's going to put it right on her belly right here. Her hands are going to be right on top of this ball, not up here, but kind of like right in front of the ball. And she's going to be pushing towards her knees. 5-second holds, about 15 times. And when she does this, she should feel her stomach kind of contract. Again, this is good for all ages. And then when she gets really good at them, what she can start doing is pushing with one hand towards her opposite shoulder, her opposite knee. Just as so. And now we're hitting a little bit more of the obliques and the core here still. Good. Again, 5-second holds, 10 times each. And if it hurts, push less. So the next stretch we're going to have Allison perform is for her hip flexors. The reason why we want to stretch them is they connect from our hips and they actually feed through our bodies and connect to our lumbar spine. When these are tight, they're going to pull on the back a little bit and they definitely contribute to pain. And it's actually pretty common for people to have tight hip flexors because we're sitting down all the time. So what I'm going to have her do is she's going to put one leg on the second step over here. And what she's going to do is she can hold onto the railings and she's going to lunge her body forward into that front leg. Now her hips stay forward and her chest stays up to make sure we really target the front of this left hip flexor right now. She could hold this 10-second holds 10 times, and then she could switch legs when she's done. You want to pull? Awesome. Allison, pick your head up a little bit. What she's doing is she's on her phone, so when go back on your phone. She's causing a lot of stress on her neck up in here. And if she's like a lot of stress, and what she's doing is she's looking down, her shoulders are going forward a little bit, her upper back is starting to curve a little bit forward. So what she needs to do is, if she's going to be on her phone, pick that phone up a little bit, bring your chin in just a little bit, and it feels unnatural. You could look down slightly, ever so slightly, and you could use your phone like this. This is a correct way to use it. If you're like this constantly, you're going to get it eventually. So remember, if you're getting any pain with any of these exercises, back off, try and find a pain-free range. If you are unable to find a pain-free range, come see your doctors here at North Point Orthopedics. And remember, do not perform these exercises if you are getting any radicular pain, if you have any groin pain, or if you have any bowel or bladder incontinence. Thank you, and have a good day.